Hello, I'm Dr. Kelly Morgan, a research fellow from Cardiff University. And during this presentation, I'd like to share with you findings from a project which looked at adherence rates to a national exercise referral scheme. So the project is based in Wales, which is one of the countries in the United Kingdom, and as shown by one of our famous beaches here. And there are approximately 3 million individuals living in Wales. And this infographic shows what the current health behaviours are of the adult population. And as you can see, just over 1 in 2 adults are meeting the recommended guidelines of physical activity. Just under 2/3 are either overweight or obese. And 10% of adults are following less than 2 recommended healthy behaviours. So in a way to tackle the rising levels of inactivity, exercise referral schemes are commonly used throughout the UK and across the globe. And in Wales, we have a national scheme and whereby a patient is referred from a health professional to a 16-week programme of supervised and group-based activities. And this includes a series of planned follow-ups also with an exercise instructor. A randomised controlled trial earlier in 2010 revealed that there were positive impacts from participating in the scheme, and that was impacts on both health outcomes and on participants' physical activity levels at follow-up. And because of this evidence base, the scheme had since been rolled out across the whole of Wales, and since 2012 it was delivered in all 22 local authorities. Yet, as we know, randomised controlled trials are considered the gold standard in terms of generating an evidence base. However, we are less clear about what happens after the trial. So what actually happens in the real world setting after the scheme has been rolled out? And that's something which this project tried to answer. So first of all, we examined scheme adherence rates over a 10-year period. And we were also interested in uncovering the predictive characteristics which were associated with scheme adherence, and also those which were associated with longer-term physical activity. And to answer this particular question, we used multi-level logistic regression models as part of the analyses. The project was based on data linkage, whereby the National Exercise Referral Scheme collected all of the data over the series of 10 years. And this data was split according to identifiable data, which was sent to a third party for anonymization. And study data was placed within a safe haven at Swansea University as part of the Secure Anonymized Information Linkage Data Bank. And through a series of processes, this data was cleaned and it was linked back up so that I could access an anonymized data set. So from this point, patients got split into 2 groups. First of all, adherers, so those who had completed the 16-week exercise program, and those who had not completed, so the non-adherers. And in order to look at long-term adherence, we categorized individuals who, first of all, completed all 16 weeks, and then of that group, how many of them were still active compared to those who were not active. The entire study population comprised just over 41,000 patients. And as you can see, the majority were female and 45% were aged 60 or over. And we noted that there was a spread evenly among deprivation groupings. 61% were found to adhere to the scheme and 39% were in the non-adhering group. Of those who were followed up and had 12-month data, so just about a third of adherers had data, 70% of these were found to be still active at 12 months. So this graph shows adherence rates to the scheme over the 10-year period. And as you can see, in the earlier years, as the scheme was completing the trial and beginning to be rolled out from 2010, adherence rates were approaching roughly 82% before declining steadily to 2013 and thereafter plateauing at around the 60 to 65% mark between 2014 and 2017. And that was considerably more than adherence to the trial, which was reported at 44%. Taking a look at predictive factors of adherence, you can see here that older individuals, those referred for level 4 conditions, so they were more complex patients, patients referred by a physiotherapist or other professional, so compared to a general practitioner, were more likely to take part, and those who had higher self-rated health scores were also more likely to finish the 16-week program. Conversely, if a patient was under age 16 years, if they were in the most deprived groupings, and if they had a mental health referral or reported, self-reported an anxiety or depression problem, they were less likely to complete the 16 weeks. And some of these echo what has been found in the earlier trial. If you think about longer term exercise, however, and if we compare what we just noted for the 16-week adherence, we actually found that patients who were older were more likely to be exercising in the long term. However, level 4 referrals were no longer a predictor. Those referred by a physiotherapist or other professionals were no longer more likely to be active. And actually, any mental health referrals, that association also disappeared. And as you can see, the remaining predictors were found to be significantly associated with long-term activity. So in conclusion, we've noted that there was a plateau of adherence rates in more recent years. However, these were significantly higher than the rates found in the initial randomized controlled trial. We've observed patterning in adherence levels according to demographic factors, reasons for referrals, and a patient's health on referral also. And all of these findings can be used to inform future practices of the scheme and also help to inform wider exercise referral schemes across the globe so that we can engage patients in the best manner and enable them to complete the entire scheme and to continue exercising in the long run. So thank you ever so much for listening. I'd like to thank my colleagues, Dr. Mohammed Rahman and Professor Graham Moore, for their support throughout the project. I'd like to acknowledge the funders, Health and Care Research Wales, and I'd love to hear more from you. If you're interested in the project, please do get in touch. And that's me. So thank you so much, everyone.